Dear friends, we are going to finish our presentation on hypertension. We saw the previous part, definition, predisposing factors. We saw sign and symptoms. Let's see the complication. In just a few slides, we see the complication. Then we end with the treatment and prevention. Treatment, prevention modalities, and we see if they can be useful to our um, uh, presentation, if it can really make a change, what we are going to be discussing now. So we agreed that hypertension is a problem. We saw the signs and symptoms. We really saw them. It's a serious one. Now, if those signs and symptoms are permanent, are there for a long time, what will be the complications? Let's see. Let's see the complications. Let's see the consequences in a very simple way to say it. What are the consequences? So now we remember our heart, our pump has vessels. Not only it is pumping, feeding other organs, but also it should feed itself. If now blood pressure there for a long time, the problem will start on the heart itself. Part of the complication, you will get what we call coronary artery disease. These vessels, we call them coronary arteries because they are off the heart. So if now they are under pressure for a long time, they will get damaged and it will start causing a disease. Not only that, it can cause what we call valvular heart disease. Imagine that pressure is there for a long time. Pressure. Imagine, let me say, you are, let's say you are 70 kilogram and somebody is weighing 120 kilogram. Now that person is pushing you. That is called pressure. Is pushing you. So now take that pressure, you put on these valves. They are showing us those small gates which are between the chambers, the upper chamber, lower chamber, the gates which goes to the big vessels. Now there is a pressure that is there always, constantly, non-stop. So the valves will get tired and they will get damaged. And trust me, to treat these valves, it's not easy. It's expensive. It needs specialists. It needs enough time to be booked, to be to get your date for treatment. So it's better to prevent them to get sick than to treat them when they are sick. This arrhythmias, it means if these valves now have problems and the vessels that are feeding the heart already have problems, the rhythm of the heart will change completely. If the heart has to pump 70 times per minute or 80 and should be regular, da, 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 da. Now it becomes da, 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 da. It will be disorganized, Normally it pumps like this. So a heart now that is disorganized, the heart will start doing its own way. So this is disorganized heartbeat. So another problem is infections. If these valves have problems, these infections might come and start damaging what? The valves, the infections, because they take advantage of what is already damaged. So coronary artery disease, particularly, we need to remember if there is fat that we consume. The fat which is too much will block these vessels to dilate. That's one problem. Not only that, it can also go inside and fill the lumen that will block the blood to pass. And worse, when there is a clot coming and get stuck here, the whole part will be damaged. You can see that you can get ischemia, which can go to what? Ischemia is lack of oxygen, and it can get to what we call infarctus. the part get dark, necrotic, it dies just because of fat. We know what we call cholesterol and fat deposition that will build up in these vessels. Then the blood will not reach the muscle. We saw the valves. We saw that once these valves are damaged, this is how we see them. You can see here they are showing us a very good valve. Once it is open during the feeding time, the blood will come inside, and once it closes, it will look like this. It will close nicely that the blood should not be returning back. Now, a valve or the doors, those small gates, once they are damaged, it does not close completely. Look at this one. You see, it doesn't close, either does not open. So whether it is having stenosis because of the infections, or they just have the high blood pressure damaged it, and it will lead to what we call heart failure. Why is it failing? Remember, this blood in the lower chamber here in the ventricles, when it is pushed, it has to go and enter in the big vessels to go to feed other organs. And the other blood will be pushed to go to the lungs, to go to heart to get oxygen. So let's see now where the heart contracts, but these doors are not closing enough so that the blood can continue. So the blood, instead of going, they will return back. If it returns back, the result, the workload will be too much. So the heart will fail in short time. So that's what we're talking about. So again, they are showing us the heart vessels, and they're showing the muscle of the heart, which was still fine, which was very strong enough to pump blood. There is the upper chamber, which we call right auricle, and there is a lower right ventricle, and these left and left ventricle, so they work together at the same time. There is a synchronicity in the work that they do. And these gates, you see this one is already opening, this one is closing. So the time this one is opening, this one should be closing so that the work can be done with synchronicity. When this one is closing, when it is closing, this one should open so that the blood can go. So that's how it should be. So once hypertension is there for a long time, not controlled, the workload on the heart will be a problem. So the issue now, again, the capillaries. The small vessels will suffer more. The small vessels, you see the blood coming from the heart, entering the big arteries, going to the small vessels, especially the end, as we are going to see, will suffer. You see the end vessels, small ones, sometimes we don't see them, but this one in the brain will suffer. We remember the brain has different sections: frontal, temporal, parietal, occipital, and cerebellum. All these parts have a function they need to fulfill, which means if a vessel that is supplying the frontal part or parietal part, whichever is damaged, is broken, is ruptured, then that part that is controlling a peripheral part of the body, that peripheral part will stop functioning. That's why you will see the development of peripheral signs, like not being able to use your arm, you can't walk, talking, depending on which part is affected. You see the clear picture of different part of the brain which might be affected if the vessels are ruptured because of high blood pressure. The frontal lobe, the parietal, temporal lobe, and occipital. We remember parietal, there are two, left and right. Temporal, two, left and right as well. You need to remember that. So if now we're speaking about the part getting damaged, if the vessels are damaged and they are no longer flexible, or they have a cholesterol, anything that can block, you can see the clots. You see here they're showing us the blockage in the internal carotid. This carotid, this blockage, if it happens at this level, it is even worse, because the whole part that is controlled, that is supplied blood by this vessel will die. So it will get damaged and it will be a permanent. This one, we call it ischemic stroke. It will cause a stroke. Sometimes it can cause hemorrhagic stroke. So normally, let's take an example for our syringe here. The syringe that we have here is a syringe. Normally, the heart has the work of pumping blood. Now, see, the blood as it pumps, the blood will pump, the heart dilate and fill again. It pump and fill again. The blood will be pumping and fill again. That's the work of the heart. So if now the pressure is too high, it's there for a long time, then it ruptures. The pressure was high, the vessel is ruptured. If it ruptures now, the risk of rupture of vessels, this is what will happen. You can see the blood in the brain. They are all over scattered. The treatment is to find the fastest way to go to block this bleeding. This one, we call it hemorrhagic stroke. The other one is the ischemic stroke. There was no bleeding, there was just blockage. It blocked, now the whole part is dark because it doesn't get oxygen anymore, no blood supply. So then the person will get intracerebral, intracranial hemorrhage, the bleeding, you know. So this is how it might look when you have too much blood. The vessel is ruptured maybe outside the brain, then the brain is pushed away. It's going down because it doesn't have any space to go. So the blood is collected between the scalp, the bone. This is a bone, and this is a parenchyma, the brain tissue. So the blood is pushing. So intracranial hemorrhage is very bad. It can kill if there is nothing is done in the emergency situation. Why? Because this will be toxic in a very short time because there is no oxygen. So this hematoma is too big that it can interfere with everything. So the fastest way to help the patient is to go with a specialist. The neurosurgeon will have to remove the bone. After they cut the bone, they remove that clot, then they stop the bleeding from the vessel. Then they bring the bone back, they cover. That we call surgical evacuation done by neurosurgeons. Then they do endovascular coiling of the what? Ruptured vessel. So that's how they do it, and they have helped many patients. So this is what we're talking about on the heart. They are showing us what we call dysrhythmia. Dysrhythmia, we have a very good functioning heart. You see, the top part contracts at the same time, it fills blood, and the lower one contracts as well. This is a normal heart. It is very synchronous, very good. You can see even the graph how it shows the contraction. But look at this now, which has what we call atrial fibrillation. This one is pumping every second. That does not even allow the other one to feel. This can be deadly. You can see the graph of atrial fibrillation. So this will be a dangerous situation to the patient. So bottom line, we need to prevent things to reach this stage. And if you're on treatment, should be very well taken. So it can also cause what we call heart failure, as we saw. If the heart has failed, the heart was normal size in the chest, normal size, you start getting a heart that is filling the chest. It's a very big heart here, very big compared to the normal. So the heart will fail. That's what we talk about. So when you do chest X-ray, you will see that the heart is too big. You see. Then angina, the pain ischemia. Before the necrosis comes, you will have the starvation or lack of oxygen. We call it ischemia. But when it is blocked completely, then it will cause what we call infarctus. The heart will, the whole tissue will die completely. Infarctus of myocardium. Myocardium is a muscle of the heart. So if it is dead, it is dead. It's very hard to unless it is done in the immediate moment when this block takes place, then they can remove it. You see, these are the different causes of myocardial infarction. When you have the narrowing, we spoke about the fat going block the vessels. And once it blocks, you can see the blood will not pass smoothly. And if there is any clot coming, the whole part will die. So this will lead to the decreased activity of the heart. This will lead to congestive heart failure because the muscle is no longer working as it's supposed to be. The heart will be congested with fluid, a lot of blood, then start getting dilated, get weak. You can see here a very good lumen of the normal vessel. And we see the faulty vessels, which are not well organized, which have a lot of problems inside. See, we are seeing here a good picture showing the good distribution of vessels from the heart going to the other parts of the body. But if nothing is done, then eventually the body will suffer in general. The other complication can be to the eye. Small vessels in the eye. Small vessels, especially on the retina, where the image should be fixed when you see something before it goes to be interpreted on the brain. You can see the small vessels, which should be everywhere, which are capillaries, will be also in the eye. You can see them here. This is a normal eye. The image will come, it will enter in the lens here. Then the image should be fixed here on the retina before this neuron, the nerve, which is the optic nerve, will take information, take it to the brain for interpretation. So if these vessels are ruptured, the whole part of retina is affected, then you cannot see. This is a good picture showing what happens if the blood pressure has complicated to the point where the eye is damaged. You see many vessels here. The many vessels inside here now, they are damaged. One, you can have hematomas inside, or you can have edema. You see in the white part, it's edematous. The water is swelling all over because of the pressure in the eye, and some vessels get ruptured. The kidneys, the liver. Remember, if the heart has failed, and the blood that's supposed to go up to go to the heart again to be utilized, then the blood will be stagnant in the lower part. If the blood is stagnant in the lower part of the body, so the liver, which was normal, will start getting swollen. It will become big. Then the patient will get what we call hepatomegaly, a big liver, which is congested with what? With blood, but eventually with the fluid, with water, because the water will start looking where to escape, because of that pressure. So some will go to the abdomen, then it will cause what we call ascites. Abdomen full of water. We need to remember, ascites is not only caused by hypertension. It can be caused by infections. It can be caused by liver diseases, specific for the liver, but hypertension, which is poorly controlled, can also result in this. You can imagine with this pressure, you can't breathe. It's very difficult to breathe with this pressure in the abdomen. So the patient will be in pain. The other signs that will tell you which eventually are complications, you see the blood is not being able to come back to the heart as normal. The same congestion we are talking about on the liver, in the tummy, in the abdomen, will be also on the neck of on the vessels of the neck. So the heart is failing, is not doing the job it's supposed to do. Then the vessels will be dilated as well. We can see now a heart that is failing, that has failed. You see, this heart, it has a muscle which is strong, very big muscle. It can contract and send blood where it's supposed to be. Now look the muscle, how thin it became. Because it has been failing over a long period of time, now it became like a bag where the water is stuck, it cannot go. This is a very serious problem. So it can complicate now into pulmonary problem, lungs, because the blood is not coming back to the heart. Then the blood will get stagnant in the lungs. The water will escape, try to escape outside the blood vessels. So you start getting what we call pulmonary edema. The water is full in the chest. This will be a serious problem. You can't breathe because of a poorly controlled blood pressure, which is too high for a long time. This is very bad. Normally, when you do X-ray, any part which looks black or darkish, it means there is oxygen, there is air on X-ray. So if it is white, then it means there is a consolidation or there is a fluid. You see now, this person needs intensive care, needs help, probably in ICU. If you don't do that, the patient cannot breathe for longer. You see here, when the blood comes normally, it's supposed to be exchanging oxygen with in the alveoli. We breathe in the air, oxygen comes in, it gets inside. Then the blood will come and leave CO2, the bad air that we need to take out. We breathe out, we breathe in. So if now there is that hypertension, which is there for a long time, which resulted in the complication, these exchange will be interfered. It won't work as normal as before. So we will start now having formation of edema, the whole body, because you see the fluid is leaking out of the vessels. The vessels, normal vessels can allow small fluid to pass. So if the water is leaking outside the blood vessels, you can see now, not only in the face, the fluid in the lungs, abdomen, the lower limbs, everywhere we have edema, formation of edema. The kidneys can be damaged as well. We know that small vessels are everywhere, particularly in the vital organs. We saw brain, heart, eyes, now the kidneys. That where we saw in the sign and symptoms that we can see blood in the kidney. We remember when we spoke about causes, we spoke about narrowing of the vessels, the narrowing of vessels of the kidney. You see a normal kidney, and now look at this narrowing. Eventually, this will also cause hypertension, and hypertension will cause a problem on the kidney. So it becomes what we call a vicious cycle. One problem causes the other. It continues like that. So a kidney which was normal, very nice, good vessels, good structures, filtering urine in normal way, it becomes damaged. That's where the problem is. If the kidney is damaged, remember it has a lot of filters, okay? And this filter, which normally keep the proteins, keep blood, it should keep normally. It should be keeping the vitamins, minerals, you start losing them because the filter is damaged. They're showing us the different filters. There are too many. Some of them are too small that we cannot see them, but when they combine together, they form a big pipe taking the urine out in the ureter. So, but only toxins and water, urine should be coming out, not nutrients. You see, these are the complications that we see, and we don't show this to scare anyone. Even if you have this problem, it can still be managed. Your part is to follow instruction, to go to hospital, get treated, and be helped. But those who are not yet there, to make sure that we are preventing to reach this stage. You see the lower limb with what we call pitting edema. The edema is so severe that it is showing too much. So we are ending this section to this slide, where I believe we saw complications and we understand very well in short. So we are going to end with the preventive measures and the therapeutic modalities that we can apply. Thank you so much again, and please, let's see the last one without forgetting to check the previous one so that we see the whole presentation complete. Thank you.